Welcome back to Body Beautiful. We're talking about laser resurfacing with Dr. Lee. And first, let me remind you that we'll be taking your calls live with any questions you have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you'll want to get a second opinion. I promise we go straight to the phone lines.
Let's go.
Let's take Tasha, Roanoke Park. Good morning, Tasha.
Good morning.
Hi, do you have a question for Dr. Lee?
Yes. So I've been to the doctor because of these light brown spots. It's not really, it's like a big segment of my forehead that has brown discoloration. And it's apparently from hormones. And I am on birth control. So they said unless I go off of it completely and it may somewhat go away, the only other method would be bleaching the skin with the creams that you use. Is there any other method that, is this...
So it's a, it's a
that they would say, or is your method better than what they recommend?
Well, I won't. It's hard to know for sure without seeing you exactly what the best thing is for you. But those are two very good options. So depending on your skin color and how easily you tan, you may be more a candidate for one thing than the other. Lasers can be very difficult with people of color. Your skin can get way too light. As opposed to just being where you want it to be. So it sounds like you've gotten some good advice, but there are other options out there, but it really depends on an in-person consultation. So,
but we've been talking about the brown spots. How many treatments would it take to
And again, it depends on how aggressive I can be with the treatment each time, and it depends also on how careful the patient is afterwards. I mean, there's a lot of patient compliance to make this work as well as it can.
And Tasha, I've mentioned earlier that I have a friend. She's also on television, and I've known her for almost 20 years. Never knew that she had rosacea, and she's been using the Photofacial for rosacea, and
it works beautifully.
And she says that she just walks in and it's done, and there's no downtime.
Right, and that's what's great about the Photofacial is that you may have a little bit of redness. The dark spots may appear to be darker for a couple of days, but usually that resolves within a week. And in terms of the downtime that we think about with swelling, oozing skin, a wound that you really can't go out in public, you don't get that with the Photofacial.
Okay. Bottom line here, I mean, are lasers safe in general?
Lasers are safe in general, as with everything else, when you're working with somebody who has experience with what they're doing, has experience with your skin type, and has experience treating a variety of patients. You can go to a center where they have the best laser. If it's not being used properly, you can be injured.
All right, so it depends on whose hands they're in. Somebody who's familiar, who also knows the patient. And
exactly. Well, that's why I'm doing it, because I felt that there was something I was missing from what I could offer the patients.
And the degree of downtime, depending on what you do, because we have talked about a couple different things here.
Right.
And maybe we should delineate.
And we should do that. So when we talk about the broadband light and doing photofacials and treating pigment and redness, we're really talking about minimal downtime. But then we go to the tunable erbium, where we can do the equivalent of a microdermabrasion, which is not a whole lot and doesn't really do downtime, to doing deep resurfacing and really treating wrinkles, particularly those around the mouth and around the eyes, which are difficult to treat. Those will have a downtime. So depending on how bad your wrinkles are, any physician you see should be able to counsel you, for me to do this is going to require 10 days of downtime for you, and we might need to repeat it 2 or 3 times.
Now, I've had callers say that they are looking into laser because they don't want surgery. They don't want to. If you're kind of trying to take the easiest, least invasive approach,
it's a great thing to look into, and it does offer some great rejuvenative options. But it's very careful not to be sold a bill of goods that, oh, really, this is going to be just like a facelift. It's not. Surgery is surgery, but there's very often times where tightening up skin a little bit, making the skin look healthier and fresher, will go a really long way towards rejuvenating you, and might get you another couple of years before you really feel like you need the facelift. But Fraxel by itself in 5 treatments is not the equivalent of a facelift.
Okay. I've also heard about used in conjunction with the facelift to
and that might
synergistically, I guess, kind of.
And my feeling about that is really that if you have horribly sun-damaged skin, you do a surgical facelift and you put that sun-damaged skin back on top of all the surgery, you're going to be compromising the results.
All right, we need to take a quick break, and then we'll get to some more of these phone calls. For more information about Dr. Lee, call her yourself, 510-704-2170, or check her out on the web at artfulsurgery.com. When we come back on Body Beautiful, we'll continue our chat about laser resurfacing, photofacials, and all things related to the face. We'll be